Hello to our Jones PT family. Dr. Liz Jones here, Dr. Natalie Weir. We're going to talk to you today about an issue called endometriosis. As you know, up here at the clinic, we treat a multitude of issues from sports injuries to orthopedic, post-surgical. We also treat a lot of chronic pain and a lot of issues that have maybe lingered for many years and just not quite been completely resolved. Out of the 8 physical therapists up here at the clinic, 6 of us actually deal pretty deeply with pelvic pain, pelvic issues, and men's and women's health issues. So today we're going to talk to you, like I said, about the endometriosis, and I'm going to let Natalie, because she has a lot of expertise in this area and her background and her training so far. So I'm going to let her talk to you about what endometriosis is and some misconceptions, some myths, and some things to watch for you as a patient.
So just really simply, it's kind of one of those diagnoses that gets a little either overused or underused depending on the region that you live in and the doctor that you see. And so one of the things that we like to talk about is understanding kind of what it is. We're not doctors in the fact that we cut you open and look at disease processes, but we understand what the diseases can do to a body. And when a body is under a lot of stress and pain, the way it functions changes. So generally endometriosis was when the tissue that's similar, and that's the key word, similar to the lining of the uterus, is found outside of the uterus, somewhere in the abdominal cavity. And that can include from the uterus and ovaries and bladder to bowel and to our liver and to our diaphragm and affect how we move, how we digest. And this can start as young as the first menstrual cycle from children as young as 10 years old, and it's even been found in women in their mid to late 70s. So there's not necessarily an age range that's, if you're 15 to 30, that's the only time that this could be a diagnosis. And one of the biggest challenges is that it is in some women a pretty extreme pain generator, and in other something that just affects quality of life, in that it affects bowel function or it affects tolerance for having urination or even tolerance for intimacy when there may be no other triggers. And so one of the things as a therapist that we can do is we can help a body understand what is more normal movement of muscles, of tissue, to allow that guarding sensation in the body to reduce, and especially if that guard has been built up over a series of 10, 15, 30 years.
So we talk a lot about pain response, tension patterns at the clinic here. So similar to what Natalie just said, you have that chronic pain and eventually your body just starts to prep for it. So it can start this inflammatory process in your body. It can fire that up. The endometrial tissue itself irritates the body and creates that response. I think one thing that we see with a lot of women is, just as Dr. Weir said, underdiagnosed or overdiagnosed. They may have been told they have endometriosis. They're not really sure what to do with that, or they have an exam and they're told everything looks normal, but they're having a lot of pain. This is a huge part, a passion of ours, to educate our patients, because even our young daughters who are just starting menstruation might have really heavy, painful periods. They have that exam, they're told everything looks normal.
Absolutely.
And
especially if a girl is in high school and she's having to miss school because of a period cycle, like, that is not normal. And that is something that's worth digging deeper into, because I just, from personal experience, when I was in high school, I had a dear friend who would call in sick and would be on the side of the road puking when she started her menstrual cycle. And I remember being 15 or 16 and not understanding why my girlfriend couldn't come to school, and yet, I don't have that issue. And so it started kind of a lifelong journey of being curious as to, why isn't this happening to me, and why is this happening to someone so dear to me?
And what we see with that exact thing is these young women now think this is normal, and so now their perception of pain becomes different, because their 10 out of 10 pain, their 5 out of 10 pain, maybe someone else's 10 out of 10.
Absolutely.
And then sometimes that can also start a different relationship even with themselves and their body, to be frustrated by this pain every month and that sort of thing. So we end up a lot of times seeing these women a lot further down the road, and there's a lot of frustration, there's a lot of grief, there's a lot of anger. It can be by now affecting relationships, infertility. Yep. There's a lot of other things that start stacking up, kind of that snowball effect with it. So our passion really is to educate you guys and to help you to know that there is something out there. There are things to look into. There are other options besides birth control or doing some of the other medications, there are other options out there to address this issue and to help you to understand it better. Some great resources. Natalie, again, has brought this wealth of knowledge to our clinic here, which we're so excited about, and to the community. So I'm going to let her talk about some of her top resources she recommends to patients, because they're really great for you to self-educate and to be an advocate for yourself.
So, as anyone who has any understanding of endometriosis or works in the endometriosis community should shout out to Nancy Peterson. She is a retired nurse who has made it her life's passion to educate people, and she actually runs a Facebook group that now has over 100,000 members from all over the world, and it's purely for educational purposes. It's not a place to find people that are complaining. It's really a beautiful place of self-education, and it's free, and it's an amazing resource with numerous doctor files on there. So if you go on Facebook, it's called Nancy's Nook Endometriosis Education, and that is one of the first places I send people. And one of their asking requirements is that for a week you spend time just reading through information and articles for self-education, and it's a beautiful thing to have a free resource for education. And if you're not into Facebook, one of my favorite books that just came out is called Beating Endo, and it's a physical therapist and a surgeon who have gone together and written a whole book looking at health, wellness, surgical intervention, nutrition, ongoing care, and what does a life look like that is on a new journey to kind of move out of this place of chronic pain. And that's a really easy resource to get a hold of on Amazon too.
So we will list those resources for you below or in the comments or something. So please feel free to reach out. You can email us, elizabeth@jonespt.com or natalie@jonespt.com. You can go to our website. If you have questions, you can definitely call us. You can set up a consult with Dr. Natalie. Just if you have questions, concerns, what is this? I've been told I have it. I think I have it. I've been told I don't. I've had laparoscopics. They say they're clear. There's a lot that goes on with this diagnosis, with this condition. So please do not hesitate to reach out, because the more information and education you can have about it, the better.
Absolutely.
So thank you again for tuning in to us. We'll post those resources for you.